We maintain a lot of different relationships with a lot of different people, but there's one that you may need to put a little more effort into, and that's the relationship with your doctor.
And joining us now is Dr. Afsh, the Director of Internal Medicine and Primary Care at Jacksonville Clinic. Thank you so much for being here.
Thank you for having me.
And we're going to talk about a primary care provider and finding a primary care physician. So let's talk about the importance of this and some of the reasons why we need to go to a primary care physician.
To be honest with you, nobody's invincible. Even when you're young, when you're healthy, you're prone to disease. Let's face it, chronic medical conditions such as hypertension, diabetes, and cancer just does not develop overnight. They are predisposed by a host of factors such as genetics, diet, lifestyle. You need to see your physician in order to determine these factors and help you avoid these, or at least slow the progression of these diseases and avoid the complications later.
And you're saying visit your primary care physician on a regular basis. Don't just wait until something happens.
Absolutely. I mean, a lot of people have routine things in their lives like waking up, brushing your teeth, going to your dentist, going to work, servicing your car. I think you have to have your routine follow up with your primary care physician just as a regular routine like you do everything else.
Well, they say if you don't have your health, you don't have anything.
Absolutely. And you know what? Research has shown very clearly that primary health care done right is amazing for healthcare outcomes. Patients live better, deal better with their diseases. In addition to all of this, health cost spending in general goes down. Patients go less to the emergency rooms, patients can be admitted less to the hospitals. In general, it's the best outcome for healthcare if you maintain your adequate follow-up with your primary care physician.
Now, so if we're feeling fine and we don't feel like, we still should be coming in to make sure that everything is continuing to function properly.
Absolutely. I mean, you have an obligation to yourself. When you go to your doctor, you don't only go for an acute medical illness. Of course, you do that. But even if you are healthy, and God wills you will be healthy, you have to go for screening, for vaccinations. I mean, we live in an era where medical technology and medicine has given us so many guidelines that we have to apply it to ourselves to avoid things. I mean, let's put things in perspective. A lot of people do not even know their healthcare variables. I mean, looking at people that have high blood pressure. I mean, if you look at the adult Americans, almost around 71 million do not even they have actually high LDL, which, as you know, which is bad cholesterol.
Sure.
That almost doubles your risk for heart disease. A fifth of the American adults do not even have this checked yet. And if you check that, you have high LDL, you can work on it to reduce it to prevent.
A lot of men out there kind of go, la la la, I don't want to go to the doctor. Women do that too. I just think if I just don't think about it or if I just don't do anything, it'll
we'll tough
go
it
away.
out, put a little dirt on it.
Right, exactly. It's hard to get the guys to go in there and the women. But having that accountability and knowing where you stand, I'm sure, as you said, makes such a huge difference. And also if you go in and your tests aren't exactly where they should be, there's a little bit of incentive with that knowledge is power to try to make a change going forward.
Absolutely. Early detection is always the best way to conquer disease. It's the best opportunity to take control of your disease and actually take care of things. Imagine if you have high blood pressure. That will be a predisposition for strokes, kidney disease, heart disease, and so on and so forth. If you come now and you know that you are hypertensive, elevated blood pressure, you can take this medication that later on would reduce the risk of heart disease for you and so on and so forth.
Gotta go in.
What are some of the common things that you're seeing as a primary physician?
Well, actually, I'd like to allude to a study that was actually published at the Mayo Clinic Proceedings last year, where actually they took around 142,000 patients. They followed them up over 4 years. And they found out that, believe it or not, the most common reasons for visit to the healthcare provider was skin disorders. People come in for dermatitis, acne, cysts. It is not common colds. Common colds came in around 5th. This was followed up actually by back pains, by joint pains actually came second, to be honest with you. And later on down the list, you could see high blood pressure and diabetes. While the most common conditions you go to is actually skin disorders.
So you pointed us in the direction of a 2009 report by the New England Healthcare Institute that determined that an increased demand on primary care by older, sicker patients and decreased supply of primary care practitioners, such as yourself, has led to a crisis in people being able to get a doctor. What would you say would be a reason for that, and what do you see then going forward?
Actually, I'd like to comment on this one because this is a very important point. In a lot of publication, you see this is really a crisis. That report actually put very clearly that we are at shortage. According to the AAMC, we are in 2020 around 64,000 primary care physicians short. But when the Accountable Care Act came into law in 2010, that expanded people under insurance to around 32 million by 2021.
But the supply was still here.
Absolutely.
As far as for primary care
Absolutely.
physicians.
But you know, in order to accomplish that, you need primary care physicians.
Right.
So this will make us short by 94,000 in 2020.
So what is your solution? You're going to see a lot of
we need
patients,
more.
my
We
friend.
need more.
We need more primary care physicians.
Can you do
Absolutely.
hours on the weekend too?
I think
And what-
cloning. I think cloning is the next step, really, right?
We are actually, but my message today is, I think everybody should think that you have to go and see your primary care physician. That is a responsibility to yourself and to your family.
And
All
build a
right. Well, thank
relationship,
you.
and don't be afraid to ask the questions
Absolutely.
whenever they
Absolutely.
come up.
You, right? All right,
Yes.
thank you so much. We
You're
appreciate
welcome.
you being here, and thanks to the Jacksonville Clinic for sponsoring the segment. To get more information, you can do so by calling 904-622-9035.